Hello everyone, Assalamu alaikum. Uh, Hope everyone is fine. Okay, so we are starting today. We will start with Dr. Pulok. Are you there?
হ্যাঁ আপু
Okay, the case number 10 is for you. Okay.
ওকে স্টার্ট করব
Yes. Doctor, your time starts now.
Hello, I am Dr. Rahman, one of the doctors in this medical ward. Are you Miss Emily Wilkinson?
Yes, doctor.
Okay. Are you the next of kin of Miss Margaret Wilkinson?
Yes, doctor.
Okay, ma'am, we are here together to talk to you about your grandmom's health issues. Is it okay with you?
Okay, doctor.
Before I start, may I know how far do you know about your grandma's health issues?
Well, doctor, I don't know anything about my grandmother, doctor. I went to a holiday with my friends 2 days back, and out of a sudden, I received a phone call from your hospital yesterday night that my grandmother is admitted in your hospital. I don't know what happened to my grandmother, doctor. Can you please tell me, is she okay?
Yes, ma'am. Actually, your grandmother has came to our hospital with a traumatic head injury, and we have done some tests, and the test reports are in my hand.
What's the reports, doctor? Is she okay?
Okay, ma'am. Actually, ma'am, I have something serious to break you.
Oh my God, doctor, what happened to her?
Actually, your grandmother's report shows that she has massive bleeding in her brain. Sorry to tell you the news, ma'am.
Oh my God, doctor, what are you saying? Bleeding in her brain? How is this possible, doctor? How did it happen?
Okay, ma'am. We are thinking that due to some, as she has had slammed with a chair, maybe this is the one of the reasons of her bleeding. Are you getting me?
Yes, doctor. Yes, I'm trying to get you, doctor. I usually take care of my grandmother. I just left for 2 days and this incident happened, doctor. I'm so shocked and I'm so terrified, doctor.
Yes, ma'am. I really appreciate your feeling, and I know this news is very shocking for you. And but we are here together to help your grandma with these situations. And ma'am, our doctors uh, have examined her level of consciousness in a scale of 3 to 15,
Mm-hmm.
and your grandmother's score is only 3, ma'am.
Oh my God, that sounds so bad, doctor. So is she going to be fine, doctor?
Yes, ma'am. Actually, ma'am, this sort of low score, the possibility of getting better is very narrow.
Oh God, doctor, this is so. I cannot tolerate this news, doctor. So what is going on with my grandmother, doctor? Please do something. Treat her, doctor. Do whatever surgery needed.
Okay, ma'am. Okay, ma'am. We have already formed a team of experts involving our brain surgeon, brain doctor, a specialized nurse, and our physiotherapist, and our and our brain surgeon has decided that actually she is not fit for any surgery.
Not fit for the surgery? Why, doctor? I think you are neglecting my grandmother, doctor. Because she is a 102-year-old lady, you are giving up on her.
Okay, ma'am. And ma'am, I really acknowledge your feeling, but this is not the case. Actually, before doing any surgery, we have to meet up some certain parameters for the surgery. And before any this type of major surgery, the patient's fitness is to be in a certain level. And as your grandmother health is not that much good, so our consultant thinks that she is not fit for the surgery. Are you getting me, ma'am?
Yes, doctor, I'm trying to get you, doctor. But is she going to die?
Okay, ma'am. I know this may sound very hard for you, but you know uh, her condition has is in such condition that uh, the chances of getting better is very minimum. But
Oh my
but
God,
we
doctor.
will
Yes,
but we will
doctor,
give
what is your
her.
plan?
Okay, ma'am. But we will give her all our supportive treatment so that she can have as comfortable, and as we can keep her as comfortable as possible.
Oh
Are
God,
you getting
doctor,
me?
this is a very hard news to take in, doctor. I love my grandmother, and now I'm seeing her suffering like this, doctor. So, how much time does my grandmother left, doctor?
Actually, ma'am, it's very early to comment on, and I can't give you a sharp answer for that. But mm, I will let you know her condition time to time. And ma'am, do your grandmother has uh, any advanced documents as for how she like to be treated in these situations?
Yes, doctor. She only thing is she doesn't want to be in pain in her last days. That's it.
Okay, ma'am, I really appreciate your grandma's choice, and for that, we will do everything that to keep her as comfortable and as pain-free as possible. And do your grandmother has nominated anyone to take decision on behalf of her?
Yes, doctor. I am her lasting power of attorney.
Okay, ma'am. Did your grandmother expressed any thought about that when her heart stops?
2 minutes left.
Okay. Did your grandmother expressed any thought about when her heart stops? What will she prefer?
No, doctor. She didn't mention anything about that.
Okay, ma'am. I like to tell you that according to her condition, our main focus would be, as her condition is not curative, we will put her a special type of care where our main focus would be to keep her as comfortable as possible, and we will not do anything which would be curative for her, and we will not resuscitate her. Do you have any idea about resuscitation?
No, doctor.
Okay, by resuscitation, I mean that when anyone's heart stops, we give some chest massage and give some medications through the blood channels, and we also
Mm-hmm.
give some special tube through the mouth, so the patient can breathe and can and her his or heart can start again. But in
Okay.
your grandmom's condition, we are thinking that we will not go for resuscitation. Ma'am,
Why,
how does
doctor?
this?
Why don't you want to do any effort to save my grandmother, doctor?
Okay, ma'am, actually, mm, the chance of recovering from a resuscitation in your grandma's condition is very minimum. And even if we resuscitate your grandmother, and the hope that she will come back is very much narrowed down. So, and again, this resuscitation have many complications, like this can cause some breaking of the underneath bones. This can cause some bleeding. This can cause some injuries to surrounding
Well,
structure.
doctor, if you do not want to do anything to my grandmother, then I will just give me discharge. I will take her to home.
Okay, ma'am, I really appreciate your concern. Okay, ma'am. Okay, ma'am. If you want, we can arrange another meeting with my consultant so that you can discuss about this matter in brief with him. Are you getting me?
Yes, doctor, your time is up. Okay, Dr. Pulok, you did great, but why did you invent the DNA here?
আপু এটা তো হচ্ছে আমার একদম মনে হচ্ছে যে মানে এন্ড অফ লাইফ অথবা প্যালিয়েটিভ কেয়ারের দিকে চলে যাচ্ছে
Yes,
ওই
the
জন্য
patient is in end of life care counseling টাই mainly করতে হবে. You don't want you don't have to invent the DNR here. Okay? কারণ DNR মেনশন না থাকলে জোর করে তো টাস্ক ইনভেন্ট করার দরকার নেই.
ওখানে দেখলাম আপু ওই যে এন্ড অফ লাইফ কেয়ারে ডিএনএ পিসিআর মানে ইউকে তো দেখি যে ওখানে একটা ইয়ে থাকে এটা নিয়ে ডিসকাস
হ্যাঁ, বাট
করা
এটা
গেছে।
ধরো এক এক সেন্টার এক এক এক্সামিনার এক এক ভাবে নিবে, বুঝছো? যদি তোমার সেন্টারে এক্সামিনারের ক্যালিব্রেশনে না থাকে, ও কিন্তু তোমাকে একটা টাস্ক ইনভেন্ট করার কারণে তোমাকে মার্কসও কেটে দিতে পারে। সো ইউ নেভার নো, ওকে? সো বেটার তোমার সিনারিও যা আছে তুমি সেটাই এক্সপ্লেন করে আসলা বারবার করে, বুঝছো? যে পেশেন্ট এখন এন্ড অফ লাইফ কেয়ার ট্রিটমেন্টে যাবে, উই উইল ট্রাই টু মেক ইউর গ্র্যান্ডমাদার অ্যাজ কমফোর্টেবল অ্যাজ পসিবল। উই উইল গিভ ইউর গ্র্যান্ডমাদার অক্সিজেন ইফ নিডেড। উই উইল কিপ হার পেইন ফ্রি. Give her some calm medication so that she remains calm, and we do not want to put your grandmother in any distress. মানে তুমি এন্ড অফ লাইফ কেয়ার ডিসকাস করো, ঠিক আছে?
আচ্ছা আচ্ছা
সেক্ষেত্রে ডিএনএ ডিসকাস করতে গেলে কিন্তু ওটা একটা ডিফারেন্ট টপিক হয়ে গেল, বুঝছো?
হুম, 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 ঠিক আছে।
এটাই বললাম, তুমি কোথায় জানি পরীক্ষা দেবে, কলকাতা না?
হ্যাঁ হ্যাঁ।
একটু সাবধানে, হ্যাঁ? এই জন্য কলকাতা কমিউনিকেশনে খুবই স্ট্রিক্ট তো। কারণ যেহেতু তোমার টাস্ক যদি বলেই দেয় এক্সপ্লেন দ্য ডিএনএ, আর দেন ইউ ক্যান ডিসকাস, বুঝছো? নাহলে হচ্ছে পুরো একটা হোল নিউ টপিক হয়ে গেল এখানে, ডিএনএ নিয়ে ডিসকাশনটা। ঠিক আছে?
আচ্ছা আচ্ছা।
ওকে, নেক্সট কেস করবে ডক্টর দীপ্র মাহাদি। আর ইউ দে?
Yes, I am here.
ওকে, দ্য কেস নাম্বার 12 ইজ yours.
Case 11 or 12?
Sorry, I guess it's 11. Yes, it's 11.
Okay. আহ, আচ্ছা, শুরু করা যায়?
Okay, doctor. Your time starts now.
Good afternoon. I am Dr. Mahadi, register on call here today. You must be Miss Emma, daughter of Mrs. Thompson, 49-year-old. Is
Yes,
that correct?
doctor.
Okay, Miss Emma. I'm here to talk about your mother's condition, or diagnosis, and further management plan. Is that all right?
All right, doctor.
Okay, Miss Emma, would you kindly start off by letting me know how much you know about your mother's condition?
Well, doctor, my mother was perfectly fine till 2 days ago. Suddenly, she developed a severe shortness of breath, and along with these breathing issues, she also had some chest pain, doctor. And it became so severe that I got scared, and I brought my mother to the ER. And there, you guys did some special tests of her chest, I guess, and gave her treatment. And I think she's okay now. I don't know actually what is the diagnosis happened. Can you please tell me what is going on with my mother? Why she had this chest pain and shortness of breath?
Uh, I appreciate your knowledge, Miss Emma. Yes, after your mother was brought to the ER, we ran a special kind of test, okay,
Mhm.
to see the blood vessels around the lungs. And initially, it looked like there was a clot stuck in the blood vessels of your mother's lung. Okay, Miss Emma.
Yes, doctor. It sounds so scary, doctor.
Yes, initially it seemed like that, and so as it is an emergency, we started her on some blood thinning medication that we gave her to the blood channels. Okay,
Okay,
then after a while, we again went back to the scan report. Our imaging consultant reviewed the reports, and he confirmed that there was no clot in the blood channels of your mother's lung.
oh my God, doctor. Are you serious? How is this
Uh,
possible, doctor? My mother was started on blood thinning medication and 2 days of unnecessary treatment. Do you have any idea how dangerous it can be?
Again, I'm very sorry, Miss Emma. It was a mistake on part of the treating team. Please accept my apology. Uh, what actually happened here was that initially the scan report suggested about the clot, but when we again reviewed the imaging by our imaging consultant, uh, it seems that there was no clot. Uh, Again, we are expressing apology from on behalf of the treating team.
This is unbelievable, doctor. Do you even understand how reckless that is? Why didn't you review the scans earlier, doctor? Why did you give my mother 2 days of unnecessary blood thinning medication?
I appreciate your concern, Ms. Emma. Again, we are very sorry, but we have been keeping her under close monitoring, and you'll be relieved to know that there is no uh, side effects or any other reaction to the medication has occurred in your mother, but we are still keeping her under close follow-up and continuously monitoring her. Our whole treating team is with your mother, and we are doing everything we can to give her the best possible treatment.
I can get you, doctor. I'm understanding all your point, doctor. But I need an explanation. You gave my mother blood thinner for no reason. Not to just any patient, doctor. An elderly woman with abdominal aortic aneurysm. Do you even realize how risky it is? What if the
Eh,
aneurysm had been ruptured because of the blood thinners? What if she had a massive bleed in her brain, doctor? Would you be still be telling that, oh, sometimes we make mistakes?
I understand your concern completely, Miss Emma. If I were in your shoes, I would be very upset too. Rest assured, we have already raised this issue in our monthly mortality and morbidity review, and we also have also filed a internal case report to investigate and see what actually went wrong. And we are doing everything we can to make sure that this kind of mistake doesn't happen again. In the
That does-
meanwhile,
yeah, doctor, but that doesn't make this okay, doctor. She was put at risk for nothing. And what if I hadn't questioned it about? What if she would continue with the blood thinner medication, doctor? She has aneurysm, doctor. There is a massive chance of there is a risk of having massive bleed in her brain, doctor. How could you do such mistake in a hospital like this?
uh, again, please accept my apology on behalf of the treating team. You'll be relieved to know as soon as the review was done, we immediately stopped the blood thinning medication and put her under intensive follow up. In the meanwhile, yes, your mother has, as you have already mentioned, this aortic aneurysm. It is the thinning out of the wall of the big blood channels in her tummy, which has been also promptly assessed by the blood channel doctors, and you'll be relieved to know they have decided that no surgical intervention is required at the moment, and your mother should be good
2 minutes.
under follow up at the moment. Are you getting me, Miss Emma?
Yes, doctor, but still I want to complain against the doctor who did the misdiagnosis first. I want the name of the doctor and I want to complain against him.
Again, I'm expressing my apologies, Miss Emma. You are definitely, you have definitely the right to raise a complaint against the treating team. I will help you file a complaint if you want. I can refer you to the patient advisory and liaison service. And if you want, you can complain. But rest assured, it doesn't matter whether you complain or not. Our treating team are wholeheartedly 100% committed to give your mother the best follow up and best treatment that we can do. Rest assured, we are all here for your mother. Miss Emma, again, please accept our heartfelt apology.
Okay, doctor, but how would I know this won't happen in future and that this won't happen with someone else?
Rest assured, Miss Emma, we are doing everything we can, including the raising the incident report and monthly reviews to make sure that this kind of thing does not happen again. May I ask you some questions about your mother, if you don't
Sure.
mind? That with whom she lives in the house, is she well taken care of or supported in the house?
Yes, doctor, she lives with me and we are supported financially.
Okay. Okay. If there is anything we can do to involve the social supporting service or any help that we can extend to her at her house through the our occupational service department, rest
No,
assured
doctor, fine.
everything we can. Okay. All right. Again, please accept our heartfelt apologies, ma'am, and rest assured our
Time is up.
consultant. Thank you.
Time is
Thank
up.
you.
Okay. Okay. Dr. Mahadi, Dipro Mahadi, you did great. This is a case of a error. It is a perceived error as well. This is a wrong reporting actually, diagnostic error. So you did great. The patient, the surrogate will be very, very angry because her mother has a aneurysm and you give the blood thinning medication and you have answered all the concerns perfectly. That the blood channel surgeons has already reviewed your mother, has seen your mother, and they determined that the aneurysm was stable and did not require any intervention at this stage. And you did your answer was correct. আপনাকে এখানে আটকানোর কোনো ওয়ে আমি দেখি নাই আপনার আপনাকে যদি মার্কস দেই তাহলে I will give you 16 out of 60. Okay?
Thank you.
Okay. So next is করবে Dr. Parisa. Are you there? Yes. Next case is yours. Start করবো?
Yeah.
Okay, your time starts now.
Hello, I'm Dr. Hawk, one of the doctor in this medicine work. Are you Mr. Ahmed, 49 years of age?
Yes, doctor.
Okay, all right. So, can you tell me more about your health condition?
Well, doctor, I'm a known case of diabetes, doctor. I have type 1 diabetes for the last 20 years and I'm taking insulin for that. But for the couple of months, I'm noticing that my vision is getting worse, doctor, and it has been deteriorating day by day. Right now, I'm seeing blurring of vision, doc. I'm having the blurring of vision, and also along with this vision problem, I'm having this pain, burning pain in my legs, doctor. It feels like pins and little sensation in my legs, and it's which keeps me awake at night, doctor, and it is bothering me a lot. Can you please tell me all of this is happening due to my diabetes, doctor?
Mr. Ahmed, I appreciate your concern. The thing is, you have diabetes, as you have diabetes for the last 20 years. And diabetes, what happens in diabetes when it is controlled, it affects different parts of your body. And in your case, you are facing some problems with your eyes and some abnormal sensation in your legs. Are you getting me?
Yes, doctor, but I'm taking the treatment for the last 20 years, doctor. So why these complications are happening with me?
Okay, all right, Mr. Ahmed. Regarding your treatment, are you taking your insulin?
Yes, doctor.
Okay, are you taking this insulin regularly?
Well, doctor, it is difficult to take regularly, doctor. Sometimes some doses are missed, doctor.
Okay, may I know why you miss your dosage of insulin?
Well, doctor, I just got tired of all the injections. I hate needle and insulin makes me feel shaky sometimes, doctor. Plus, doctor, life gets busy and I thought I could manage without the insulin, doctor.
Okay, all right, Mr. Ahmed. I appreciate your concern. The thing is, you need insulin for controlling your diabetes mellitus. And the thing is, yes, I do understand many people have difficulties with needle. Now with advancement of technologies, now these insulin needles are getting like replaced with very small needle. It's like a pinch. Okay.
Well, doctor, still it's painful, right? I'm just tired of doing this every day, doctor. But I also sometimes when I take insulin and I see the needle, I feel weak and shaky, doctor. And
Oh,
I don't want to take those needles anymore, doctor. This is a painful thing, doctor.
all right, Mr. Ahmed. We will form like a multidisciplinary team with the hormone doctors and with the insulin nurse or diabetes nurse. The thing is, there are now with advancement of technology, there are some advanced technologies available in which the needle will be so small sized it, and also we will review your regimen. Okay, as you are having difficulty regarding this.
Okay, doctor, I will try the new injections you're telling me, doctor. But what about my complications, doctor? My eyes, my feet. I feel like my body is breaking down, doctor.
I'm so sorry that you are going through this situation, because it is a very it's a long-standing disease, and we will actually tag you with the eye doctor and also to the food. Have you been recently, may I ask, that are you visiting or regularly getting follow-up with the eye doctors and the food?
No, doctor, I have missed so many appointments, doctor. I got busy with my job and I couldn't maintain it.
Okay, all right. Okay, all right about this. Because yes, people can get busy, but health is also very important. So the thing is, we will again we send you to the eye clinic and the food. The thing is, if the as you are not taking your insulin regularly and in the intended dose, what is it doing? It is actually causing some problem in your eyes. And if you further miss appointments and do not take your medications regularly, there is a chance you might get blind.
Oh my God, doctor, it feels overwhelming, doctor. I
I'm
feel like I've done too much damage already.
uh, I'm sorry, Mr. And for that, we will actually talk with the eye doctor so that
Hmm.
whatever damage has done, we want to stop it right there. Okay. And about this tingling and numbness feeling you are having in your feet, about that we will also actually have an appointment foot clinic and also to doctor so that we can prescribe some medications regarding it, and uh, need to follow some food hygiene in your case.
Okay, doctor. So if I take the treatment you are saying, so will I be normal again?
Um, but okay, all right, Mr. Ahmed, I do understand your concern, and it is a very valid concern. The thing is about diabetes is that it is not a curable condition. It is a controllable condition. We can control it. We will follow you up from time to time, and you need to take your medication and do visit. Uh, Regular visit to the eye doctor, kidney doctor, and the food clinic, so
Okay.
that
But sometimes I forgot to take the insulin doses, doctor, because I'm a very busy person. I have a lot of work to do. So sometimes I forgot to take the injections.
no problem, Mr. Ahmed. Many people do miss because they are
2 minutes
busy.
left.
What we can do actually about this? You can download app. There are some reminder app that is at the Google Store or in the iCloud or what, I, and they will help you to. They will remind you that this is the time of taking medication. Okay, and if uh, okay, and we will review your insulin regimen also, so that it will be like so that you will have a better understanding of taking your insulin. So may I ask you some question?
Sure, doctor.
Okay, do you drive?
Yes.
Okay, and in this condition, as your you have problem with some with your vision, it is better if you stop driving right now and inform the DBLA, okay, because it can be hazardous.
Okay.
And do you drink?
Yes, doctor.
All right, as you are okay, but the thing is that do you binge drink?
Sometimes.
Okay, so may I ask you that please cut down on your drinking and drink alcohol in moderation because it can worsen your condition. And do you smoke?
Yes.
Okay, it is better if you stop smoking. I will referring to the smoking cessation clinic. May I ask what you do for a job?
Well, doctor, I work as a manager in a company, doctor.
Okay, is okay. If you have any problem regarding this, we can refer you to this worker help you regarding your job. Okay.
Okay, that would be a great help, doctor.
All right. So in the meantime, I'm going to arrange a meeting with the eye doctor and the and diabetic nurse and also with the food clinic so that we can arrange a plan for you that will help you.
Okay, doctor, that would be a great. Hello? Are you
Hello.
there? Yeah.
Okay. And in the future, please try to keep take your insulin at the intended dose so that your diabetes control and and you will that and in that way you can have a good life and it will help to prevent the complications that comes
Okay, your
with
time
diabetes.
is up. Time is up. Okay, Dr. Parisa, you did great. This is a case of insulin non-compliance. You have to make sure why the patient is not taking the insulin properly. Here, I have already mentioned that the patient has fear of taking the needles. So you have mentioned about the insulin pens, but you have to mention about the insulin pumps as well. There are also some insulin pumps which will eliminate the need for the frequent injections. ইনসুলিন পাম্প কিছু আছে যেগুলো স্কিনের নিচে দেওয়া থাকে, যে যখন যখন দরকার হয় তখন আপনার পাম্পটা ইউজ করতে পারে। এছাড়া হচ্ছে পেশেন্টকে আরেকটু এক্সপ্লেন করতে হবে যে ইফ ইউ ডু নট টেক দ্য ট্রিটমেন্ট প্রপারলি আপনার আর কি কি কমপ্লিকেশন হতে হবে। ইট অলরেডি এফেক্টেড ইউর আইজ এন্ড নার্ভস, ইট ক্যান অলসো এফেক্ট ইউর হার্ট অ্যাজ ওয়েল, and sometimes it can cause the high blood sugar can cause slow healing, like if you develop an infection it can lead to severe tissue damage, it can cause serious heart problem, there is increased risk of heart attack and stroke in future. So you need to be adherent to your treatment. Okay. সো বাকি সব ঠিক ছিল মোটামুটি, যে আই ডক্টর, ফুড ডক্টর অ্যান্ড কিডনি ডক্টরস কাছে পাঠাবো। অ্যান্ড ওয়াই দিস ইজ হ্যাপেনিং বিকজ অফ দ্য হাই ব্লাড সুগার অ্যান্ড ইউ আর নট কমপ্লায়েন্ট উইথ দ্য মেডিকেশন। সো what for the eye problem you will refer him to the eye doctor, and for the nerve problem you will say that this happens when the high blood sugar damages your nerve. We will refer you to the diabetic doctor, and also it can be manageable with some medications, but the best way to prevent it from worsening is to control your blood sugar. So our main goal is to control your blood sugar. This will slightly reduce the symptoms you are having right now. ঠিক আছে? ওকে, তাহলে এরপর নেক্সট কেস পড়বে হচ্ছে ডক্টর শাওন। আর ইউ দেয়ার? আচ্ছা, শাওন মে বি বিজি, তাহলে
আপু
নেক্সট কেস।
আছি আছি আমি আছি
ওকে ওকে, তাহলে কেস
শুনতে
নাম্বার 30।
আপু স্টার্ট করবো?
Okay, doctor, your time starts now.
Hello, this is Dr. Farooq, one of the register on call at today's Snap Clinic. Am I talking to Mrs. Ali, wife of Mr. Ali, 58 years old?
Yes, doctor.
Okay, I'm here to talk to you regarding your husband's health issue. Is that all right for you?
All right, doctor.
Okay. Do you need anyone else to attend this meeting with you today?
No, I'm fine.
Okay. So before proceeding further, may I know how much have you been told about your husband's condition?
Well, doctor, I know my husband is suffering from a condition called motor neuron disease. It's been 6 months, doctor. He is suffering from it, doctor. And I can see that his condition is progressively getting worse day by day. He has the weakness of his muscles. I can see that he has difficulty in swallowing. He has difficulty in his speech. And he, nowadays, there is increasing dependence on the caregivers, doctor. And we are trying to cope up with the symptoms, but suddenly, for the last 3 days, I'm noticing that my husband is having a fever and breathlessness, doctor, and he's coughing a lot while eating, doctor. So we brought him to the ER, and he was admitted here. So I don't know what is the reason of this time of him getting admitted, doctor. What is going on with my husband, doctor?
I appreciate your concern, Mrs. Ali, and I'm really sorry for all the sufferings your husband is having right now. And as you told that your husband is brought to us with some fever and some cough, and after bringing to our hospital, we did some imaging of your chest, and the imaging reports revealed that he has some bad bug infection in his lungs. Are you getting me?
Yes, doctor. So how is this possible, doctor? Why? How he had got this bug in his lungs, doctor?
Uh, I appreciate your concern, Mrs. Ali. Actually, uh, as he is a known diagnosed patient of motor neuron disease, in which condition the nerves of our body affected and causes weakness, progressive weakness in the muscles. And in your husband's case, it also affected the muscles involved in swallowing. So for this reason, he is having some swallowing difficulty. So when he tried to swallow, some of the food went to his windpipe to his lung, causing this infection. Are you getting
Oh
me?
yes, doctor. I did notice that he was coughing more while eating and drinking, doctor. Does that mean that his condition is getting worse?
I appreciate your concern, Mrs. Ali. You know, actually, motor neuron disease, it's a condition which is actually not curable, and it's progressive in nature. And unfortunately, I'm sorry to tell you that in your husband's case, it's progressing day by day, and it's causing more and more weakness of different part of his body. Are you getting me?
Yes, doctor. I was hoping that we could stop it from getting worse, doctor. Is there anything that we can do?
I appreciate your concern, Mrs. Ali, but you know, this is a condition actually which is not curable, but uh, there are some some management options to reduce the sufferings in the day-to-day life. So, do you want to hear about them?
Sure, doctor.
Okay. So, regarding his management, we are going to form a group of specialists involving brain doctor, lung doctor, physiotherapist, occupational healthcare worker, and also specialist nurse to provide a management plan. And regarding the bug infection, we have been already treating him with bug killing medications. And as he is having some issues with his swallowing, so we are going to involve our speech and swallowing and language therapy team to so that they can help him so that they can help him with the swallowing issue. If there is still further problem with the swallowing, then we may need to go for tube feeding. Are you getting me?
Yes, doctor. Are you talking about any feeding tube? So what will
Uh,
happen if we do not want to put him on feeding tube, doctor?
I appreciate your concern, Mrs. Ali. You know, uh, if he continues to have swallowing problem and we do not put him in the feeding tube, rather we just continue giving him his feeding by mouth, there is high possibility that he will choke in on his food, and the food will go to his lung again, and there will be again severe bug infection, which may be fatal for your husband's condition. Are you getting me?
Yes, doctor. I do not want to see him suffer like this, doctor. Is there any treatment option available to slow it down, doctor?
I appreciate your concern, Mrs. Ali. You know, actually, it's a condition which is not curable, and there, but we can provide your husband some treatment to reduce his suffering, and there are some medication available. Uh, but it will be, decided by our brain doctor. But I'm sorry to tell you that the medication will not cure his condition. Are you getting me?
So, doctor, that means that he is in his last stage.
Uh, I'm I appreciate your concern, Mrs. Ali, but I'm not saying that he is in his last stage, and it's very much it's difficult for me
Two
to
minutes left.
comment on this that how long he is going to survive. But we can reduce the suffering he is having by with proper management. Is it all right with you?
All right, doctor. What should I say? I'm seeing my husband suffering for the last 6 months, doctor, and it is getting overwhelming, doctor, and I cannot see him suffer like this. So, do whatever is needed to make him as comfortable as possible, doctor.
Mm. I appreciate your concern, and also we are going to involve our physiotherapist team to who will give him some physiotherapy to improve his muscle strength to some extent. And also we will involve our occupational healthcare team so that they can uh, make some necessary adjustment at your home uh, to make things easy for your husband. Is it all right?
All right, doctor. I don't know how to tell my children, doctor.
I appreciate your concern, Mrs. Ali. In that case, we can arrange another meeting so that we can break this information to your other family members uh, in pieces. And do you mind if I ask you some questions?
Sure, doctor.
So, what were your husband doing?
My husband was a businessman.
Okay, is he financially supported?
Yes, doctor.
Okay, do you need any support at home?
No, doctor, we're fine.
Okay, do you have any other concern that I can meet up?
No, doctor, I got all your points, doctor. I'm saying that my husband is condition is getting worse day by day, and I have to like see him suffer like this. I have nothing to do.
I'm sorry for the all the bad news I've given to you today. But don't worry, you are not alone in this journey. The whole team of our hospital, we are with you, and we are going to do everything possible to keep your husband as comfortable as possible. Are you with me?
Yes, doctor, your time is up. Okay.
Okay.
ওকে ডক্টর শাওন, ভালো হয়েছে। এবার যেরকম মানে লাগতো করা ওরকমই এমপ্যাথি থাকতে হবে ভয়েসে, বিকজ পেশেন্টস কন্ডিশন উইল গেট ওয়ার্স এন্ড ওয়ার্স, এটা আর কি পেশেন্টের ওয়াইফকে বুঝাতে হবে। ফিডিং এর এটাও ঠিক আছে যে ইন ফিউচার হি মাইট এন্ড আপ নিডিং সাম ফিডিং টিউবস, ইট উইল বি ডিসকাসড টু ইউ বাই আওয়ার সল্ট
আপু
টিম।
আপু একটু আপু আপু আবার বলবেন, আমি ডিসকানেক্ট হয়ে গেছিলাম।
ও আমি বলছি যে
I'm
ইউ হ্যাভ অ্যান্সার্ড অল দ্য কনসার্নস কারেক্টলি। এখানে
Yes.
বলতে হবে, পেশেন্টকে এক্সপ্লেন করতে হবে, পেশেন্ট ওয়াইফকে বলতে হবে যে দিস ইজ আ প্রগ্রেসিভ ডিজিজ এন্ড অ্যাবাউট দ্য ফিডিং, yes there he might end up needing some feeding tubes, but it will be decided after by our SALT team, which is salt and language therapy team. They will decide and reassess your husband's condition and come back to you. So to আপনি এখনই মানে ডিটেইলস এ ফিডিং এর কথা বলবেন না, জাস্ট বলবেন he might need some feeding options in future, but বাকি সবকিছু ওভারঅল it was good. Okay, next case
Okay.
করবে ডক্টর সালসাবিল, are you there?
হ্যাঁ আপু আমি আছি।
Okay.
হ্যালো আপু শুরু করব?
Okay, your time starts now.
Hello, I'm Dr. Salsabil, one of treating physician of this hospital today. May I confirm that you are Mr. James, 68-year-old?
Yes, doctor.
I'm here to discuss with you about your health issue and further management plan. Is it okay for you?
All right.
Do you need anyone else to attend our discussion today?
No, I'm perfectly fine.
So before starting our discussion, to be in the same pace, can you please tell me how much do you know about your condition?
Well, doctor, I know nothing about my condition, doctor. Actually, I had this breathing problem for the last few days, doctor, and 2 weeks ago it started, and gradually I'm seeing that it is getting worse day by day. And actually, I had a history of skin cancer 6 years back, so I'm so scared, doctor. What if my cancer is back? For that reason, I came to the hospital, and you guys did the imaging of my chest, and you said there is some fluid in my lungs, I guess, and you did some other tests too. And after the treatment I got better, and you gave me discharge, and today I'm here to collect my reports, doctor. I'm so worried. Is this the cancer that happened 6 years back? Is my cancer is again happening in my chest?
I appreciate your concern. Actually, yes, you're right that we did some imaging of your chest, and due to you have some shortness of breath, and it was found that there was some fluid in your lung cavity. But unfortunately, for that reason, we decided to tap fluid from your chest. And unfortunately, due to labeling error, it was not processed.
What? How is this possible, doctor? How is this possible that you are doing you have lost my sample due to these error issues? This is an important report, doctor. You put a needle in my bag, collected the fluid, and you have lost the important report, doctor. So how is this possible? This is completely unacceptable.
I can understand your concern. I can understand that this is really unacceptable. If I were in your shoes, I would also react in the same way. Your anger is totally justified, and I'm really sorry for this whole situation.
No, 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 doctor. How is this possible, doctor? I had this is breathing issues and fluid collection in my lungs, and this report is important for me, right?
I can understand your concern. Yes, you're right that this is really important. And also for further management plan, we did another imaging of your chest, in which we found multiple growth in your chest.
Oh my God, doctor. So is this the cancer?
I understand your concern. I'm afraid to tell you that it may be spread of cancer that you had and that you had undergone excision 6 years ago.
What? What are you saying, doctor? Then the report that you lost was so important, right? So what are you going to do with that? You have already lost the report. And now what is your plan?
I appreciate your concern, and I seek apology from you for the whole incident. Now we are planning to tap again from your lung covering and for a study for if there is any cancer cell or not. Our consultants had decided this to tap again from your chest. Are you with me?
Yes, doctor, I'm with you, and I'm trying to understand what is going on. I'm just shocked, doctor. You are saying my cancer is back, and you have lost an important report. So you are going to do the test again, and again you will put a needle in my back, and you will send the report, and the report will come 2 to 3 days later. So my treatment will be delayed, doctor.
I can understand your concern. You're right that time is a big factor, but still, we are not out of time. We are doing everything. We are doing our best possible way to care for you. And would you now want to know our management plan?
Yes, doctor, please tell me.
So, our consultant, after assessing you, decided to do another tap from your chest. And after knowing the report, we will treat you accordingly. Is it okay for you?
How could this be okay, doctor? What if you again lost the sample, doctor?
I understand your concern. I assure you that this will not happen again. We have already formed an incident report. We have informed our consultant and nurse in charge. We have also informed root cause analysis team to find out what was actually happened. So this will not happen again. And this time we will write in bold form and in capital letter in your sample so that this will not loss again. Is it okay for you?
Okay, doctor, but like 6 years back, I had the surgery. My cancer was removed, doctor. So this time, surgery is possible.
I appreciate your concern. Actually, it is too early to comment. At first, we have to know the report of your fluid. Then, our treating team, involving our lung doctor, lung surgeon, specialist, nurse, cancer doctor, will review you. Then, we will be in better position to say it will be possible or not.
Well, doctor, I'm really disappointed with your service, doctor. I want the name of the staff who did the mistake, doctor, and I want to complain because for him, my treatment is delayed now.
I'm again sorry for this incident. Actually, no single doctor is responsible for this. Our whole team is responsible for this.
2 minutes.
If you want to make a complaint, I'll refer you to patient advisory liaison service and I will guide you to make a complaint. Don't worry, it will not hamper you taking further treatment. Is it
How
okay
can
for you?
I believe that it will not happen in future, doctor?
I appreciate your concern. I assure you that this will not happen in future. We will be more cautious. We will take every precaution in every step so that this does not happen. We'll also raise the issue in our next morbidity mortality meeting and arrange a seminar symposium and discuss the whole matter. Are you with me?
Yes, doctor, but please do it early as possible because this report is very important for my diagnosis, I think. And you are saying that my cancer might get back. So I'm really worried and I want to know the report, doctor.
I can understand your concern. We are here to give you our best possible care. We are trying to do the earliest way so that we can know your result and treat you accordingly. Do you have any more concern?
No, doctor.
Okay, if you don't mind, may I ask you some more question?
Sure.
With whom are you living?
I live with my wife, my children.
Are you supported at home?
Yes, doctor.
What do you do for living?
Well, doctor, I am a retired school teacher.
Are you financially supported?
Yes, doctor.
Okay, if you don't mind, may I ask you, do you smoke?
Yes.
I think you should stop smoking. It is injurious to health. If you face any difficulty, I will refer you to smoking cessation clinic. Do you drink alcohol?
Sometimes.
Is it within social limit?
Yes, doctor, I try to maintain it within the social limit.
Okay, that's appreciable. And if you don't mind, and do you have any more concern?
No, doctor.
Okay, I will give you some leaflet, brochure, and website links so that you can read more about this. And I will also give our hospital's contact number so that you can contact us if you have any worries and queries. Is it okay for you?
Okay, doctor.
Yeah, I again seek apology from you. I'm really sorry for the whole incident, and I assure you that this will not happen. And we are here for your for your care and treatment. Do you have any more concern?
No, doctor, just do it as early as possible, doctor, because I'm so worried that my this is the cancer that I'm having. So I want the report as early as possible.
I appreciate your concern. I assure you that we will be trying to do as early as possible and be sure that your health is our utmost priority. Do you have any more concern? Okay, thank you. Hope you will get better.
Thank you so much. Okay, doctor, this is a case of simple case of a medical error because the sample is lost due to the labeling error. So you did great. Yes, you have to mention that there is a possibility. I have asked that cancer is back or not. We are not sure yet, but there is a possibility. As we can see in the special scan of your chest, there are some spots in both of your lungs. So there is a possibility that the cancer is back. Okay, otherwise everything is good, that nothing to worry. It's a simple medical error. কোনো কোনো জায়গায় ভুল হয় নাই, এভরিথিং ওয়াজ কারেক্ট।
আচ্ছা আপু, আর সার্জারির কথা বললে কি আপু যেভাবে বলছে এভাবে বলবো নাকি বলবো
হ্যাঁ,
যে সার্জারি? আচ্ছা
it is very early to comment right now. We will go do the further tests. So we will form the multidisciplinary team. Our team will decide what the further management about the further management path. Okay.
Okay, Appa.
Okay. So next case will be Dr. Shriti. Are you there?
হ্যাঁ আপু আছে
Okay. Case number 15 is yours.
15 আচ্ছা হ্যালো
Yes.
হ্যাঁ আপু শুরু করি
Your time starts now.
Hello, I'm Dr. Mamutaz, one of the register on call. Are you Mrs. Sarah, 42 years old?
Yes, doctor.
Okay, nice to meet you. Today we are here to discuss about your health issue. Is it okay with you?
Okay.
Okay. Do you want anyone to accompany you during this discussion?
No, I'm fine.
Okay. So, Mrs. Sarah, may I know how much do you know about your condition?
Well, doctor, since childhood, I'm having this migraine, doctor, and it is so bothering for me, doctor. It comes on and off, and for the last couple of years, I'm noticing that the pain is different, but it's coming almost every day, doctor. And I'm taking some pain medication like cocodamol. At first, it would work, but nowadays, I'm noticing that this painkiller is not working as well, doctor. So I went to my GP. Said like, what is happening with me, doctor? I think this headache is different, and I'm noticing that it is not going away. It is putting me in a lot of stress, doctor. I cannot do my daily activities. I cannot go to my work. It is so stressful right now, doctor. So can you please tell me what is wrong with me?
Okay, I am very sorry for your sufferings, and you suffered a lot for a long time. So, for your this suffering, we also did a imaging of your brain, and the reports is in my hand now.
What is the report showing, doctor? Is there any cancer in my brain?
I appreciate your concern, and there is a good news that the reports shows normal.
How is this possible, doctor? Why I'm having this headache then?
Okay, for this, our treating team has reviewed you and your condition, and they decided that you are suffering from a condition named medication overuse headache.
Medication overuse headache? I have never heard of that, doctor. What
Okay,
does?
don't bother with the medical term. Would you like to know about more about this?
Yes, doctor.
Okay, so for you had a previous history of migraine, and for this you took some medicine opioid like cocodamol for almost daily for a long time, and this medicine may also cause this type of headache that you are suffering now.
But I took those painkillers because of my headache, doctor. And now you're telling me that the painkillers are causing them? That doesn't make any sense to me.
I appreciate your concern. Sometimes some medicines like these opioids like cocodamol or even also some paracetamols may cause this type of headache when they are used for long time. Are you getting me?
Yes, doctor, I'm trying to get you, doctor. So you are saying that the medication I take to stop the headache is actually making it worse?
I'm afraid that I'm telling you that the medicine you are taking for your painkiller for your treatment of your migraine now also causing your headache more severe. Are you getting me?
Yes, then how will you treat me, doctor? If I stop taking the painkillers, won't my headache get even worse?
I appreciate your concern. Yes, some as you are having this headache, so we need form a multidisciplinary team for you, and we had a plan for you. Would you want to know about this?
Yes, doctor.
Okay, so now we are form a multidisciplinary team, including brain doctor and brain doctor, occupational therapist, physiotherapist, and we will form and for your migrainous headache, we will review your previous medicines, and also we adjust our your medicines, which is so after seeing by our brain doctor, and the medicine you are taking, the cocodamol, we will stop it gradually. Are you getting me?
Yes, doctor, but that sounds really difficult, doctor. What if I can't handle the pain?
Okay, don't bother for this. So we have another options, and we will give you another medicine to as a painkiller to reduce your headache. Are you getting me?
Okay, doctor. So what should I do when I get the migraine?
Okay, and for your migrainous headache, you also need to some lifestyle modifications, and you need to avoid your triggers, like you need to avoid highlight or flickering of lights, high
Mm-hmm.
loud sound, or you need to avoid light high sound, and you should have enough sleep, and also you should take your food regularly. Are you getting me?
Yes, doctor, I'm trying to get you, but this will be really hard for me. I have been relying on the painkiller for a very long time.
Yeah, I appreciate your concern. For your this painkiller, we are just changing your painkiller. Don't bother with this. And we for your this type of headache, this painkiller is the responsible. Our treating team is thinking this, and we are gradually withdraw this medicine, and for instead of this medicine, we are giving you another medicine named NSAIDs. Are you getting me?
Doctor, okay, doctor, if I take the medication and stop the cocotamol that I'm taking, will my headache will go away?
Okay, it's
Two
a little
minutes left.
okay. In gradually, your headache will be goes away. It is not goes away in instance, but you need to have some patience. And whenever we will stop gradually this type of medicine, your headache will be gone away within a few months. Are you getting me?
Okay, doctor, then I will try my best to stop taking the cocodamol, doctor.
Okay, and may I know, do you have any other concern that I can meet up?
No, doctor.
Okay, so what do you do for living?
Well, doctor, I am a school teacher.
Does your symptom affecting your job?
Yes, doctor, a lot. I cannot take the classes.
Okay, I'm sorry to hear about this. In that case, we can involve our social worker and occupational health worker as well. Do you smoke?
Yes.
Smoking is injurious for your health and also can increase your symptoms. So you need to stop smoking. I can help you to refer you to the smoking cessation clinic. Is it all right?
All right, doctor.
Okay. Do you drink alcohol?
Yes, doctor.
Is there any binge drinking?
Sometimes.
Okay, I'm telling you that also alcohol can increase your headache, so you need to cut down your alcohol drinking. Are you getting me?
Okay, doctor, I will try my
Okay.
best.
Okay. Do you drive?
Yes.
Okay. Does your driving affected by your headache?
Sometimes, doctor.
Okay. In that case, you can stop driving for a while and inform DVLA. So,
Okay.
do you have any other concern?
No, doctor.
Okay, I can give you some brochures and leaflet and also our contact number. Anytime you can contact with us if you want. And do you want
Okay.
anyone to drive you at home?
No, doctor, I'm fine. Your time is up.
Thank you.
Okay, Dr. Sriti Apu, you did great as well. এখানে হচ্ছে medication overuse headache একটু explain করেন যে I can understand that how confusing this sounds. Initially the painkillers help, but when taken for too long, especially for more than 2 to 3 weeks or 2 to 3 times a week, the body starts relying on them. When the medication wears off, your brain triggers for another headache, making you feel like you need more painkillers. This creates a cycle where the headaches become more frequent and resistant to the treatment. ঠিক আছে? আরো যে
আচ্ছা
আমি বলতে যে কি কি করব, how to improve, you can still take the medication, but we will give you another type of medication, and we will also focus on some other strategies like staying hydrated, avoiding the triggers, using the cold compressions, resting in a quiet dark room, and practicing some relaxation techniques like you can try doing some yogas. The key is to limit the use of medication for not more than 2 to 3 times a week to avoid the falling back into the cycle of overuse. ঠিক আছে?
আচ্ছা আপু মেডিকেশন ওভারইউজ হেডেকের এই এক্সপ্লেনেশনটা একটু পরে যদি পাঠিয়ে দিতেন তাহলে ভালো
হ্যাঁ,
হতো।
আমি তাহলে গ্রুপে সুন্দর করে লিখে পাঠিয়ে দেবো নেট।
থ্যাংক ইউ।
ওকে, তাহলে নেক্সট কেস করবে ডক্টর তুষার। আর ইউ দেয়ার?
হ্যাঁ আপু আছি আমি।
কেস নাম্বার 16।
হ্যাঁ আপু শুরু করবো?
Okay, doctor, your time starts now.
Hello, I'm Dr. Tushar, one of the treating physician of this lung ward today. May I confirm that you are Miss Jennifer Thompson, daughter of Mrs. Margaret Thompson, 82 years of age?
Yes, doctor.
Today we are here to discuss about your mother's health condition and further management plan. Is that alright with you?
All right.
I believe you are the next of kin of your mother.
Yes, doctor.
So before proceeding our conversation, may I ask you how much you know about your mother's condition?
Well, doctor, I'm really worried about my mother, doctor. She has never been like this before. She was completely fine before coming to the hospital, just a bit slower than she used to be. But now she's confused and doesn't recognize me sometimes and is even seeing things that aren't there, doctor. This is very distressing. What is wrong with my mother, doctor?
I'm really sorry for your mother's condition. Would you mind if I explain this condition a bit more?
Yes, doctor.
Okay, thank you for giving me the opportunity to explain this. Actually, as you already know, that your mother was admitted in our ward with some infection in the chest, so that we already do the proper management, like giving some back killing medicine and also some oxygen. But unfortunately, for the last 3 days, she is having some condition in which she cannot recognize people seeing abnormal things and she's confused. Are you with me?
Yes, doctor. So what condition you're talking about?
I appreciate your concern. Actually, in in the medical term, we called it confusing state or delirium. Have you ever heard of this?
Delirium? I have never heard of it before, doctor. What's causing this?
Okay. And don't be bothered with the medical term. I'm here to explain it to you. Actually, it's a condition in which sometimes our body when gets sick, and sometimes it affects on the brain for a short period of time, in which we cannot recognize people, we cannot behave normally, and we seeing things that other people cannot see. And in this state we called it delirium or confusing state, but unfortunately your mother is facing this.
But what is the reason behind this, doctor? Why my mother is suffering from like delirium?
Actually, we are suspecting that as your mother is having some in bug infection in the chest, it might causing this delirium or confusing state, and most likely this is the reason behind this abnormal behavior. But don't worry, we are here to give the best possible care, so that we hope that your mother will get cured.
Well, doctor, I have heard about dementia. So is this dementia? I have heard people developing memory loss suddenly like this.
I appreciate your concern. Actually, it's too early to comment, though it's too early to comment, but usually in the thing you're saying, this dementia is normally not this much dramatic, like this much aggressive behavior or a confusing state. It is normally more happen over the long time, but in your mother's case it is happen a bit rapidly and within short period, which is not in usually seen in dementia. Are you getting me?
Yes, doctor. So, doctor, how long will this last, doctor? Will she get better?
I appreciate your concern. Actually, it's too early to comment right now because we don't know how her body will respond to the medicine and treatment. And usually it is not that long, and we can let you know the how far the things can progress. Are you getting me?
Yes, doctor, but that's really concerning. What can we do to help her to recover, doctor?
Okay, I appreciate your concern. Would you like to hear more about the management plan?
Yes, doctor.
Okay. Actually, we are going to involve a multidisciplinary team involving lung doctor, infection bug specialist, and brain doctor with specialist nurse, and they will do whatever the best for your mother. And in this condition, as you already know that we already give the back killing medicine, also there might need some calming medicine to calm her down, and also there will be a specified specialized nurse in this case to give every possible care to your mother. And also you can help her by giving some familiar object like some calendar, picture, photograph to place around her, and we can give her we can give the calm environment. Are you getting me?
Okay, doctor, but I have noticed that she gets really restless and trying to get out of the bed, doctor. Is she safe?
I appreciate your concern. Actually, I can see that you are very caring for your mother, but be sure that we also care for her. And yes, it's a bit risky condition. In this condition, she's trying to get out of the bed, but don't worry, already we will give her the specialized specific nurse for her only, so that she will give the proper care, and also we will give the calm medicine so that she will calm a bit down. Are you getting me?
Yes, doctor, but is there a chance that she might not recover fully?
I appreciate your concern. Actually, it's too early to comment whether the things will go, but usually we have seen that it recovers very well. But we don't know yet what will be the fate in your mother's case.
Well, doctor, how much time will it take to get normal, doctor?
Actually, I appreciate your concern. Actually,
2 minutes left.
uh, usually it takes a few days, and we will let you know the how the things will progress, and we will update you regularly.
Well, doctor, can I visit my mother?
Okay, I appreciate your concern. Actually, we will discuss this matter with our treating team, and we will let you know whether you will get the permission or not.
Okay, doctor.
Do you have any other concern right now?
No, doctor, I just want to see my mother normal again. That's it.
Okay, don't worry. We are here to give her the best possible care. May I ask you some question if you don't mind?
Sure.
With whom does she live?
She lives with me, doctor.
Okay, and does she is she financially supported?
Yes, doctor.
Okay, and what does she do for living?
She's not doing anything currently, doctor.
Okay. And may I ask you, does she have any advance directive living will or power of attorney?
Yes, doctor. I am her lasting power of attorney.
Okay. And may I ask you some personal question about her, if you don't mind?
Sure.
Okay. Does she smoke?
No.
Does she drink alcohol?
No, doctor.
Okay. And I'm going to give you some leaflet brochure and website so that you can know more about this condition. And I'm going to give the contact number of our department so that you can call us at any time if any worries or queries. Is that all right with you?
Okay, doctor. Your time is up.
Okay. Thank you. Hope we'll get better.
Thank you so much. So, Dr. Tushar, why did you bring the LPA here?
অ্যাকচুয়ালি আপু আসলে মানে আমি টানছি হচ্ছে কারণ মানে এইজ পার্সন আরেকটা হচ্ছে যে আমি জানি না আসলে কোন দিকে যাবে, তো আমি ভাবতেছিলাম এটা হিডেন কনসার্ন থাকবে কিনা।
No, patient has delirium. It will get better if the chest infection is better.
ওকে আপু।
It is acute condition. It will get better after taking
ওকে
the treatment for the pneumonia. Okay.
ওকে আপু। ওকে আপু।
Can I visit my mother? Yes, sure, you can. You can visit your mother. You can bring your other family members too. You can make an friendly environment around her. You can gently try to recall her about the time, the place, the persons. It will be better if the familiar persons, the visits are more and more. এখানে একটা ফ্যামিলি এনভায়রনমেন্ট ক্রিয়েট করে রাখতে হবে পেশেন্টের আশপাশে। পেশেন্টকে আইসোলেট করতে হবে ইন আ ওয়েল ভেন্টিলেটেড রুম। পেশেন্টের ফ্যামিলিয়ার অবজেক্ট রাখতে হবে, ফ্যামিলি মেম্বার্সদের ভিজিট করতে হবে, আর নার্সের শিফটিংটা চেঞ্জ মানে বারবার যাতে নার্স চেঞ্জ না হয় এটা এনশিওর করতে হবে যে একই নার্স ওকে বারবার দেখে। হ্যাঁ, নট
আচ্ছা
লাইক
আপু।
দ্যাট যে স্পেশাল নার্সই ওকে দেখবে, জাস্ট নার্সের শিফটিংটা যাতে না হয় এইটাই।
ওকে আপু।
Okay, আর what are the causes behind? There is multiple causes behind it. Right now, what we can see is the chest infection she is having is the culprit behind it. So as long
ওকে
as
আপু।
we treat the chest infection, this condition will go away. Okay.
ওকে আপু।
Okay. So next
আচ্ছা
question
আপু,
will be.
একটা প্রশ্ন
Yeah.
আছে আপু, সেটা
Yeah.
হচ্ছে এই কেসে তো আমাকে সরাসরি বলা নাই যে এটা ডিলিরিয়ামই, হ্যাঁ, আমি
এটা
সাসপেক্ট করে
delirium.
নিলাম। সাসপেক্ট করে নিলাম। তো এক্ষেত্রে কি মানে খুব ঝামেলা হবে যে মানে আমি সাসপিশন করে নিলাম যে এটা এই ডায়াগনোসিস হবে। ইউজুয়ালি তো সিনারিওতে ডায়াগনোসিস লেখা না থাকলে বলতে মানা করা হয়।
হ্যাঁ, বাট আপনি এটাকে ট্যাকল করতে পারতেন অন্যভাবে। ইওর মাদার ইজ সাফারিং ফ্রম an কন্ডিশন ওয়্যার দেয়ার ইজ acute confusional states development. ডেলিরিয়াম ওয়ার্ডটাই ইউজই করলেন না তাহলে,
আচ্ছা আপু।
হ্যাঁ, যদি লেখা না থাকে। বাট এই
ওকে।
সিনারিও দেখে পড়ে তো মনেই হচ্ছে এটা ডেলিরিয়াম আর কি।
হুম।
ঠিক আছে,
ওকে আপু।
ওকে। তো নেক্সট কেস হবে ডক্টর মোনা।
জি আপু আছি।
ওকে, কেস নাম্বার 17।
জি আপু। আপু শুরু করে দিই।
Okay, doctor, your time starts now.
Hello, I am Dr. Monem, one of the medical register of this medicine ward. Am I talking with Mr. James Anderson, 58 years old?
Yes, doctor.
So, what would you prefer to be called?
You can call me James.
So, Mr. James, we are here to discuss about your health issue. So, can you please tell me what you had today?
Well, doctor, 3 days back I had this severe chest pain, and I came to the ER and where I diagnosed with the case of heart attack, and you guys did a intervention to me. Yeah, and I'm feeling fine now, doctor. I think my chest pain is gone, and I really don't see the point of staying here any longer. I would like to go home today, doctor.
Okay, thank you very much. And it's our pleasure to hear you that you are now doing well. And may I explain more about your condition, please?
Sure, doctor.
Okay. So, Mr. James, you are in our hospital with some complaint of your chest pain, and that time we undergone a procedure that is called coronary angioplasty to remove the clotted blood in your blood channel of heart. After that, you are feeling well, and at that time, you have been developed some symptom like you develop some abnormal shakiness of your body and some some abnormal movement and sweating in your body. Is it all right?
Yes, doctor. Yes.
So as far we know that you are a diagnosed case of diabetes mellitus. Is it all right?
Yes, doctor.
And you are taking alcohol for the long period of time. Is it all right?
Yes, doctor. Correct.
Okay, as during this procedure, as you stop this taking alcohol, and you suffered from a condition that is called alcohol withdrawal syndrome. Are you getting me?
Okay, doctor. I'm getting you.
So, have you previously heard about this condition?
No, doctor.
Okay, I may explain more about this
Sure,
condition.
sure, doctor. Sure.
Okay, when anyone taking alcohol for the long time,
Mm-hmm.
if he stop taking this alcohol for a particular period of time,
Mm-hmm.
then some symptom appear into him, so that and you are suffering such like this problem actually. Are you getting me?
Yes, doctor, I can get you, doctor. Yes, I know I have the symptoms, but I do appreciate everything you and your team have done so far, and I just don't like to be in the hospital, doctor. I think I can take care of myself at home.
Okay, I appreciate your concern. As your symptom is appeared, then we initially treated you with some medications, and your condition is stable now. But we have to keep you in our hospital for for some times to follow up for next few days. Are you getting me?
Yes, doctor, I'm getting you. But what is the worst that can happen if I leave the hospital today?
Okay, I appreciate your concern. As you are suffering from this alcohol withdrawal symptom. If we let you go now, it may cause a serious side effect like delirium tremens. Don't bother the medical term. If we stop alcohol for a particular time, there may be a serious life-threatening condition appeared in someone like abnormal shakiness of body or abnormal high blood pressure may develop, or loss of consciousness may develop, and it may endanger your life actually. Are you getting me?
Yes, doctor, I guess I didn't think about all that, doctor. But I just hate feeling trapped here in the hospital. I'm not liking the food of the hospital, doctor.
Okay, I appreciate your concern. If you like, if to solve this problem, I will inform it to the nursing in charge, and I think they can solve it actually. Are you getting me?
Okay, doctor, I'm getting you, doctor. I get what you're
Okay.
saying, but I still feel like I can manage it at home, doctor. Can you just prescribe me the
Okay.
medication and I will take them as you say in the home, doctor?
Okay, I appreciate your concern. And do you have any particular reason for which you want to go home actually?
No, doctor, I just don't feel like home here. I feel trapped and I don't like the food. That's it.
Okay, I appreciate your concern, but it is the matter that if you want to go home now, it may endanger your life any times. So it is better. So our treating team made decision on the best interest of your health condition to keep you for some days. Are you getting me?
Okay, doctor, but can you please prescribe the medication so that I can take it at the home, doctor? I'll just take the pills like you tell me to take it, doctor.
Okay, I appreciate your concern. The medication we prescribe you that means benzodiazepine and the diazepam, and there is some side effect of this medication. We should adjust this
2 minutes
medication by
left.
keeping you in we should adjust this medication by keeping you in the hospital. For this reason, you also have to stop. You also have to stay in our hospital, and you has already have a heart attack. For
Mm-hmm.
this reason, you also need to stay hospital for some days. Actually, are you getting me?
Well, doctor, I'm trying to get you. As you are saying that there are a lot of complications, then I think I need to stay here.
Yes, I appreciate your feeling and also knowledge. So, may I ask you some question, please?
Sure.
So, do you drive?
Yes.
Okay, as this condition may affect your driving, so that's why I want to say you that you have to stop driving for a particular time, and refer to the DBLA. Do you smoke?
Yes, doctor.
As you are heavily smoking, so I want to say you to stop smoking because it may endanger your life. I refer to the smoking cessation clinic, and they'll do needful for you.
Okay,
So
doctor.
you already drink heavily, is it all right?
Yes, doctor.
So I wanted to say you that you have to try to cut down of taking alcohol because it may endanger your life, and I refer to the alcohol anonymous clinic. Are you getting me?
Yes, doctor. That would be
So
great.
what do you do for living?
Well, doctor, I'm a businessman.
Is this condition affecting your job?
Yes, doctor, a lot.
Okay, I am sorry to hear you that. I will refer to the occupational worker and they will do needful for you. With whom do you live in?
I live with my family, doctor. I have my
Are they
wife,
doing
I have
well?
my children.
Okay, are they doing well?
Yes, doctor.
Okay, so you have to maintain some specific lifestyle for you, like you need to take the regular exercise and a diet modification of you. For this reason, I want to refer you to the dietitian. They will give a special diet chart, and also need to cautious about your sexual activities because you are undergoing a procedure that may hamper your life. Are you getting me?
Okay, doctor, your time is up.
Thank
Okay.
you very much for your cooperation.
Okay, Dr. Monem, you did great. You have answered all the concerns very correctly. Yes, the concerns were right. I can understand there is a you are having patient যখন বলবে যে I am feeling comfortable now, I can go home. Yeah, আপনি এটা ঠিক সুন্দরভাবে বলছেন যে you are having some withdrawal symptoms. Right now, the symptoms are mild. It can the early signs of withdrawal you are having. If you leave now, the symptoms can get worsen significantly and lead to severe complications. Like it may threaten your life. It can cause a serious complication where you might have some confusion, hallucination, and also fits. So it would be better if you stay in the hospital and complete your treatment. And regarding, I will just take the pills at home. এখানে আপনার বলতে যেটা বলছেন সেটা ঠিক আছে যে right now we are giving you a medication which needs monitoring. So if any complications develop, we need to act promptly. For that reason, you need to stay in the hospital under our medical supervision, which couldn't be available at home. ঠিক আছে?
জি আপু,
কি সব আপনার ভালোই হয়েছে মোটামুটি।
জি আপু, থ্যাংক ইউ।
ওকে, আর একটা কেস আছে, লিসেনার্স এর মধ্যে কেউ পার্টিসিপেট করতে চান? Anyone from the listeners? Yes, Dr. Kundu, case number 18 is for you.
তারপর শুরু করি।
Yes, doctor, your time starts now.
Hello, I'm Dr. Kundu, one of the registered on this surgery clinic today. So am I talking to Mr. Salim, 58 years old?
Yes, doctor.
Uh, so I'm here to talk about your health condition and give you a management plan for your condition. Is that all right with you?
All right, doctor.
So do you want anybody to be present in our discussion today?
No, doctor, I'm fine.
And so, to be on the same thing, may I know how about you know about your health condition, and do you have any expectation from our discussion today?
Well, doctor, I have been managing well since last 4 months, doctor. As you
Mm-hmm.
know, I had a cancer on my left hand, and you guys did the surgery, and I believe the surgery was well taken care of. But no, for
Mm-hmm.
the last few days, I'm noticing some pain and swelling in my hand again, doctor. Is there something
Mm-hmm.
wrong?
Mm-hmm. Mr. Salim, I'm really sorry for your sufferings, and I'm here to give you the full care and support regarding in your conditions. And at the same time, I would like to say some mistakes has happened from our side, but actually that was not intended. At the same time, that is not acceptable at all. Kindly accept
What
our
kind of
sincere
mistake,
apology.
doctor? What are you saying?
Yes, I can understand this is might be horrible for your conditions. Do you want me to explain me actually what happened
Yes,
to
doctor,
you?
please tell me what's wrong.
Mhm. Yes, a couple of months ago, you have underwent a surgery, but that surgery was not successful at this moment totally due to total we have failed to cut all the cancer part of your hand,
What?
and
What are you
unfortunately,
saying? I don't understand. You are saying that the surgery wasn't successful and I wasn't
Mhm.
even told about it?
I do apologize again for that. Actually, these kinds of things is not happened in our day-to-day practice. But unfortunately, this was happened to you. We are also surprised regarding that. And in the meantime, regarding your conditions, we have already filed the incident report and escalate this matter to our senior and nurse in charge, and also informed our risk management team. And hopefully we'll discuss this issue in the next monthly morbidity meeting. That's these kinds of things should not happen in the near future to any other patients.
This is unbelievable, doctor. So, what is your plan now, doctor? Then do the surgery again.
Actually, yes, you are right, Mr. Selim. Your condition was being reviewed by our treating team, and unfortunately, the time the mistake was done. Actually, what happened? We need to investigate. But your surgery was not successful at this moment. I can say that at this moment, and that's why your cancer has been spread other parts, and that's why we need have to cut your hand at this moment, according to the decision of our teaching team.
Oh my god, doctor. Are you serious? You're saying that you're going to cut my hand? You are telling me that I have to lose my hand because of this mistake?
Yes, I can understand that this is not for your sufferings, and anyone in your shoes would feel the same. I can understand. I could only imagine how you are feeling now. But I do apologize again for what happened to you.
Well, doctor, this is a lot to take in, doctor. I don't even know what to say. What happens if I don't go through the operation? I
Mhm.
don't want to cut my hand, doctor.
Yes, at this moment, no one wish to lose his hand because of mistakes of anybody else. But unfortunately, something was happened to you. We are also apologize for that things that should not be happen to anyone.
What if I
But
don't go
the
for the
things,
surgery, doctor?
sorry.
What if I don't go for the surgery?
In that case, I am sorry to inform you that the cancer will extend more further. You may lose your single hand, uh, this point hand from your one limb. Sorry to inform you that.
Well, doctor, I just never thought it would come like this, doctor. What will be the life after that? How will I going to manage?
Yes, this is certainly something serious is going to happen. It's just really shocking for you. I can only imagine. And your anxiousness is totally justifiable at this moment. But be assured that you are not alone. Our total team is besides you. And regarding that issue, will involve a group of specialist doctors like cancer doctor, skin doctor, specialist surgeon, specialist nurse, physiotherapist, occupational therapist, social worker, and also we will give some artificial hands. That's you can do something as like your normal hand.
Well, doctor, will I need further treatment like chemotherapy or radiotherapy after the surgery?
Actually, it's very early to comment at this moment.
2 minutes left.
Our treating team will be decided for that. What will be suitable for your conditions.
Well, doctor, I
And
want compensation. You guys did the mistake and I want compensation for that.
Yes, you have every right to do that. First of all, you have to. I must say, you have gone through some physical, mental, and financial losses, I think, and you can claim compensation through the patient advisory liaison services. And when your complaint will proceed, NHS resolution will monitor through your complaint, and they will give you some compensations. And in that case, if you are not satisfied with this with that compensation, then you can seek advice from the legal solicitor who is specializing in the field of medical negligence. I hope that will helpful for you. I at the same time I apologize, and this compensation is not for your sufferings at the same time.
Well, doctor, this is a lot to take in, doctor. I need some time to think.
Yes, sure, you can take time. If you agree, then we will arrange something like need to consent to go for the surgery. And do you have any other concern at this moment?
No, doctor.
So may I ask you something?
Yes, doctor.
So what do you do for living, Mr. Salim?
I am a businessman.
I think this might be affect your day-to-day activities very much. In this
Yes,
regard,
doctor. Now you're saying that I have to lose my hand, so it will affect my activities, doctor.
Yes, I can understand that. It's totally understandable. And in this regard, we will involve our occupational health department and social worker to help you regarding this issue. And I will also give you some brochures, leaflet, contact, and website addresses. That's so you can go through all the things, and you can have some knowledge from those things. And also our contact number. Anytime you can contact with us.
Okay, doctor, your time is up. Okay, Dr. Kundu, you did absolutely great. এখানে আপনার হচ্ছে যেহেতু পেশেন্ট অ্যাংরি থাকবে ওর অ্যাম্পুটেশন হবে, সো আপনার কনসার্নস গুলো অ্যান্সার গুলো ওয়াজ পারফেক্টলি ফাইন। পেশেন্ট কম্পেনসেশন চাইলে ইউ হ্যাভ টু গাইড দ্য পেশেন্ট টু দ্য রেসপেক্টিভ ইউনিট, and patient complain করতে চাইলে you have to guide to the pulse, and বাকি অ্যান্সার্স গুলো ওয়াজ পারফেক্টলি ফাইন। ওকে, এখানে আর নাম্বার কাটার কোনো স্কোপ নাই। আপনি যেভাবে অ্যান্সার করছেন ভালো এমপ্যাথি ছিল, ভয়েস এমপ্যাথি ছিল, বাট একটু একটু আপ এন্ড ডাউন নিয়ে কথা বলবেন যাতে রোবোটিক না শোনায় আর কি। হ্যাঁ, আপনি কোথায় সিট পেয়েছেন ভাইয়া?
নেপালে আপু।
আচ্ছা, নেপালের পরীক্ষা কবে? যে কিছুদিনের মধ্যেই তো মনে হয় 22 তারিখে।
হ্যাঁ।
Acha. All the best, bhaiya. Your preparation seems good. Communication is good. Rest আপনার বাকি stations গুলোর দিকে মনোযোগ দেন। আর overall আপনার performance বেশ ভালো ছিল, হ্যাঁ? And regarding the compensation, আপনি যেটা বলছেন সেটা একদম perfectly fine. আর otherwise যদি কারো কোনো ডিপার্টমেন্টে পাঠানোর কথা না বলতে চান, সেক্ষেত্রে আপনি এভাবে বলতে পারতেন যে if you wish to pursue a formal complaint and explore the possibility of compensation, I can guide you on the to the appropriate steps. I can provide you the details how to contact to the hospital administration and legal team. They will investigate the whole scenario, what happened, and discuss any possible compensation if ঠিক আছে? আর যদি কমপ্লেন করে then you have to refer him to the pulse. Otherwise everything is good.
জিজ্ঞেস করে কি কারণে সার্জিক্যাল ইররের পসিবিলিটিস আমরা সাধারণত বলি যে এখানে কি বলা যাইতে পারে, বা আসল সিনেমা তো কেউ জানে না মনে হয়।
না মানে অ্যাকচুয়ালি সিনারিওটা কি আসছে সেটা তো জানি না, বাট আমি একজন ক্যান্ডিডেটের সাথে কথা বললাম, আমি যেভাবে সিনারিওটা দিয়েছি পরীক্ষা হলে এইভাবেই আসছে, যে ওনাকে আসলে পার্শিয়াল রিসেকশন করা হয়েছিল, বাট সামহাও পেশেন্টকে এটা জানানো হয়নি। পেশেন্ট জানে না, পেশেন্ট জানে যে ওর ফুল রিসেকশন হয়েছে, পেশেন্ট ইজ গুড। আফটার ফিউ ডেজ ওরা পরে ওনার ফাইল ঘাটতে দেখছে যে পেশেন্টের অ্যাকচুয়ালি পার্শিয়াল রিসেকশন হয়েছে, অ্যান্ড নাও দ্য পেশেন্ট ইজ হ্যাভিং হ্যান্ড পেন অ্যান্ড সোয়েলিং, অ্যান্ড এখন পেশেন্টের অ্যাম্পিউটেশন লাগবে, কারণ পার্শিয়াল রিসেকশনের কারণে ক্যান্সারটা স্প্রেড হয়ে গেছে। এরকমই ছিল সিনারিওটা মোরলেস।
না, পার্সিয়াল রিসেকশনটা কি জন্য হয়েছিল আর কি, মানে
ও
সার্জিক্যাল
আচ্ছা,
এররটা কি কারণে, এটা
এইটা
আসলে
আসলে
জানা
এটা
যায় না
আসলে বলা,
পার্সোনালি।
না না মানে আমি জিজ্ঞেস করছিলাম ক্যান্ডিডেটকে, বলছে এইটার কোনো রিজন লেখা ছিল না, জাস্ট এটাই লেখা ছিল।
না, আমরা তো বলি সাধারণত এই কারণে হইতে পারে, এক্ষেত্রে আসলে কোনো কিছু বলার আছে কিনা আসলে এটা আমি জানতে
না
চাচ্ছিলাম।
যেহেতু আপনার সিনারিওতে মেনশন করা নাই, সো আপনার না বলাটাই ভালো। আপনার সিনারিও যা
ও,
আসবে আপনি
আচ্ছা।
তাই
হ্যাঁ
ডিসকাস।
হ্যাঁ হ্যাঁ, আচ্ছা ঠিক আছে আপু, আচ্ছা।
ঠিক আছে, that's all for now. Next session will start at 10 p.m. Dr. Anika Apu will take your session, okay? The rest of the exam cases will be discussed by her. So that's all for now. Allah Hafiz everyone.